Hey everybody, it's Elijah from Blue Ridge Motion. Today we're going to talk about recovery process for treating minor neck injuries. Now when I say minor, I'm talking more along the lines of something like some strain, maybe something you get from kind of like a whiplash effect. Reason I'm doing this is because about 3 days ago, I injured my own neck. I was doing a movement that I was not mentally or physically prepared for. I should have, there are steps you can take, and I just didn't take those steps. And instead, what happened when I went to perform this move, I ended up upside down somehow, and on top of a mat, I landed on the upper back side of my head and ended up taking my chin to my chest and then folding my legs over my head, which luckily is something that I kind of practice and prepare for through a series of different exercises. But to give you the visual, so we have this being my head, this being my legs. My head went down because I opened up out of this move and my legs came over, boom, just like that. Needless to say, it was not comfortable and my body had a pretty instantaneous shock reaction where pretty much everything tightened up super quick and became sore almost immediately. I put myself through kind of a basic assessment. I wasn't dizzy or confused. I didn't have any symptoms of a concussion or anything crazy. So I figured, okay, this is just a really bad strain. I'm just gonna go ahead and go home and immediately start my recovery process, which is what I'm going to share with you guys here in this video. So before we begin though, I have to get this out of the way. This video is for informational purposes only. I'm not a medical professional. This is not medical advice, etc., etc. This is just me talking about what I'm doing for myself. All right, first thing, be prepared to be in pain. Recovery is usually not a comfortable process. It takes time. You're going to be uncomfortable and miserable for a while, especially if you did what I did. And see, that should be expected because our body has this natural trauma response where when something crazy happens and your body stretches too far, too fast, it has what's called a myotatic reflex or a stretch reflex, which is where you stretch and your body suddenly contracts because it hasn't been trained to go that far. So it kind of freaks itself out, and that tightening quickly can cause muscles to tear or muscles to strain and so on. So that's pretty much what happened with my neck. Was I did a lot too much too soon, and of course ended up with a little bit of pain. So like I said, expect it, be prepared because recovery is not a comfortable process. So with that, I'm going to share a list of my do's and don'ts for recovery. First thing I try to do is reintroduce motion and mobilization to the area. This is again assuming this is not a major injury like a break or something crazy. This is literally just strain. The only problem is that the muscles are super sore and super tight. Essentially what I do is a series of exercises where I literally just try to move my head around. Pretty much looks like this. If you had seen me the day I did it, this was not really possible. Okay, so even right here, the moment I get to this point, it starts to get a little like twitchy, spasmy, and I just have to stop, take a breath, and go a little further. And it hurts, but it's like a good hurt like you get with muscle soreness. Of course, everything needs to be done slowly. Now the hard part is actually going up and down because this was the way I injured my neck, so my body has a particularly strong reaction to me going that way. So I can get about this far. Show you that. That's when my neck starts to feel really tight, when things are starting to tighten up. So if I sit here for a minute and treat it like a regular stretch, supposed to hold a stretch for like a minimum of 30 seconds. You hold it for, a duration of time, and as your body can relax, you relax a little more into the stretch. So this is what I have after about 2 actual days and 3 nights of rehabilitating my neck. I can move this way, that way, this way, that way. Ooh, it's really tight on my right side. And I can go up a little bit and down a little bit, right? So the simple premise is that if the injury is minor enough, you should introduce mobilization as soon as you can. This works for things like sprains as well. If you sprain your ankle and you can't move it for day 1, then you just take some time, give it the night to kind of recover a little bit. But as the time follows and as you can, you start to try to move your ankle in circles, little circles, slowly getting bigger movements. You don't want to re-injure yourself. excuse me. You don't want to re-injure yourself. You want to reintroduce movement, because what happens is you'll kind of like solidify, let's say, and your body will build up scar tissue depending on the type of injury, and it will actually limit your mobilization because it's trained itself not to go any further, and it's healed that way. Personally, I would try to mobilize anything that is pretty much not a break. So sprains, I try to start mobilizing as soon as possible. The second thing that I started doing a lot was self-massage. This is a pretty simple thing, and I would only really recommend it if you understand a little bit about massage and a little bit about your body as well. But in short term, the way I like to do it is I kind of do like a pressure point massage, or I guess it's kind of shiatsu technically. I will kind of grab an attachment point for where the muscles attach that are sore, or I'll actually go directly to the muscles that are sore, and I'll kind of help them stretch out that muscle by moving while I'm pulling or putting pressure. The third thing I did that helped a lot was a hot compress, or hot and cold therapy. You can do this a number of different ways, and depending on the injury, you can do it a number of different ways as well. The simplest way for my particular example was a hot and cold shower. I started off, got the water as hot as I could stand and just let it kind of loosen everything up. And then I would put it to as cold as I could stand and let it kind of cause everything to tighten up. And then when I put it back on hot, everything would relax. What this does is increases circulation and helps promote faster healing in that part of the body. So I coupled that with mobilization, with massage, and so I'm sitting there in hot water, massaging, moving, and then cold water a little bit, because you don't want to do too fast if your muscles are cold. And then I go back to hot and do some more mobilization, and that helped a lot. I went from not being able to move my neck at all that night, just after that hot and cold shower, to being able to pretty much do this, which is good. But I should mention as well, you can also just do this with a washcloth. You get it wet, as hot as you can stand, put it on. If you have ice packs, you can swap between them, and then stick the washcloth in the microwave for a little bit to heat it back up, put it back on, and this is a really nice way. It usually feels pretty good as well. But once again, expect there to be pain, because it is a painful process. Everything's gonna take time to heal your body, especially depending on your age, depending on what you did, the severity of the injury. Mine was bad enough to be painful, and it's probably going to hurt for the next 2 weeks, but I think I'll be able to fully move around with minimal pain within the next couple of days, as long as I keep doing what I'm doing. Now for my don'ts, it's a relatively small list. The first most prominent one for me personally is I try to avoid taking ibuprofen or things that are going to dull or numb the pain. Now if I were in obviously unbearable amounts of pain, sure, medication's fine. But the problem with ibuprofen is that it will actually more than likely prolong your recovery time, because your body has these natural reactions to trauma that you go through, where you roll your ankle, it swells up and it stabilizes the ankle and tells it not to move. And pain is your body's way of communicating a problem and telling the body to solve the problem by sending the appropriate things to heal the body. So when you take something like ibuprofen, or when you ice something, you can prolong your recovery time by a little bit, because you're essentially fighting your body's mechanisms for repair. And so I try to avoid that to help myself recover quicker, but that's really a matter of personal choice, personal opinion. If you're in a lot of pain, do what you need to do to feel relief. Now, oftentimes we don't think of all those little things that become so much harder when we are injured, so I'm going to share with you some of those things to be expecting if you have suffered a neck injury of some sort, that are going to now be much more difficult. Getting out of bed. That is probably the worst so far. Two things that have really helped me the past couple nights with sleeping a little more comfortably, still not easy but still worth it, is a squishy pillow that actually kind of contours to the shape of your body. Anything that causes your neck to be in any sort of different position is usually uncomfortable, so one of these guys has been really nice. The second to that is a heating pad. I essentially plugged this in, and I've just been leaving it on the back side of my pillow and sleeping like this. And I don't leave it on during the night because I don't feel safe doing that. So if I wake up and I'm in a lot of pain, then I turn it on and I just kind of lie there for 10 or 15 minutes and then turn it off. But that's helped as well, because in the morning, you're sleeping for so many hours, you're just not moving. So your body kind of gets in that like re-solidified state, and you have to like reintroduce movement. This morning I pretty much couldn't move again. I was just like, it was painful. But I just turned on the heating pad for a few minutes and just kind of started to move around a little bit as I was there. And then, you know, before you knew it, I was able to get a little bit of motion back, and then I got out of bed. So like that's one tip right there. Another thing you can expect to be kind of challenging is putting a shirt on. I didn't really think about it a whole lot until that evening when I went to take off my shirt, and I was just like, ow, ow, ow. Because you move your neck a lot when you're trying to adjust and get your face out of this thing. And of course, other simple things like trying to get into your car, or anything that you could possibly think of that involves you having to bend your neck over to get into something or lean over something. So that's pretty much it. That is what I am doing to treat my neck. One more thing I'll add to that is, just for caution's sake, I did go and I saw my chiropractor and had him, kind of look it over. He agreed it was muscular, and then he hooked me up to what is essentially a TENS unit, which is kind of like electrical stimulus device that they hook up these little paddle electrodes to you, and then it causes the muscles to contract and do their thing. So that was pretty good. That's kind of like stretching and working out muscles without having to actively have done them. So it's a weird feeling, but it's a good form of therapy, I think. It helped me anyways because it increased circulation and helped things move. Thank you guys for watching. I hope you found this video informative and interesting. Don't forget to be practicing safely. That is very important. I was just disregarding some things that I should have been considering as I was doing these movements, and I find that the only time I get hurt is when I'm doing things I did not prepare myself for. And neck injuries can be a really big deal. They can be very serious, so they should be taken seriously. Train for the worst case scenario. Prepare your body by stretching, by being flexible, by being strong. And when things do go wrong, expect the recovery time to take time. Be positive, wait it out, be patient. All right, that's my advice. Thank you guys for watching. Look forward to seeing you guys in class. It's currently day 5 of injury recovery. Doing my warm-up. Heater on my back. Yes, I do always look this good when I first wake up. Doing some recommended stretches. I went ahead and watched like 2 videos the other day, so that pretty much makes me an expert. Essentially, it's all stuff I was already doing, with the exception of 1 or 2 exercises that I thought I would try. Once your muscles are warmed up, you're supposed to hold these like normal stretches for at least 30 seconds. Supposed to do that like 5 times. The exercise that they recommended was pretty simple. It's pretty much a shoulder shrug that you hold for 5 seconds at a go. You repeat this like 12 or 15 times to fatigue the muscles so that way it's starting to relax. So let's see if that works. It's actually pretty interesting because it hurts for about 22 seconds and then it starts to feel a little more released, and I feel like I get a little bit more range as I go. But obviously I've still got a little ways to go. So it has been about a month. As far as I can tell, I am pretty much 100% better. Recovery is a bit of a painstaking process, but it is totally worth it when you actually get there. Even after a month of just consistent stretching and all, you know, you're probably still gonna feel discomfort and you're probably still gonna feel tight. And so just keep stretching, keep moving, and you'll get your mobility back. You'll get your flexibility back. The stretches you saw me do are pretty much the same stretches and self-massage techniques I was doing every day to get myself back to a functional point where I was able to actually move around and be, you know, stable again. So now it's a matter of reconquering those fears that stopped me from progressing before, and this time training smarter and not rushing to skills that I'm not mentally and physically prepared for. An important thing that I need to note that is if you are watching this because you have suffered a neck injury, I am not a medical professional. I am not a physical therapist or an athletic trainer. This is all information that I've been applying to myself, for myself. You should certainly seek medical professional help for things regarding neck injuries and stuff like that, because that's a big deal. This is literally just for educational purposes, yada yada yada, I'm not a doctor, etc. You know, so that's my disclaimer. This is just for informational, educational purposes. I hope you guys aren't watching this because you have a neck injury, but if you are, certainly seek medical professional help and get the proper rehabilitation you need. So I hope you guys enjoyed this video. Everything that we're doing would not be possible without you guys.